I'm excited to talk to you about healthcare quality for children on the autism spectrum. And I first of all want to thank our previous speaker, because I think this presentation dovetails with it really well, in that she really talked about what primary care providers and health and educational providers can do in the clinical setting for kids on the autism spectrum. And this talk is more about the healthcare system performance as a whole. And so that's great. And then the other thing I wanted to say is that I think that, I spent my previous talk talking about healthcare disparities among children with autism, but I think that when you think about this talk, an important point to be had is that, in a way, having autism spectrum disorder itself is a disparity, and that all children on the autism spectrum, regardless of their social circumstances, are at pretty high risk for poor healthcare quality. And I just wanted to really bring that up as an important point. So the goals of this talk are to define healthcare quality for children on the autism spectrum, and to discuss why actually even assessing healthcare quality is really challenging in autism. Then we're going to use the Maternal Child Health Bureau Systems of Care Core Outcome for Children with Special Healthcare Needs indicator set to look at how children with autism compare with children with other conditions across several key core quality measures. And then I just threw in a couple other considerations and important quality measures for autism that I think that we need to consider in this context. And then finally, I just wanted to touch on briefly, and I think this will come up in the panel a little more, about why healthcare, achieving good healthcare quality is such a challenge in autism. So I think we should start by just talking about how we define healthcare quality. I just wanted to start with one effort which was made by the U.S. Department of Health and Human Services, which is the Healthy People campaign, which started in 2000. And the goal of Healthy People, which was renewed again in 2010 and 2020, was to set health care quality goals for people in the United States, and then also to establish measurement parameters to see how we're doing in terms of achieving those goals. And a really nice feature of Healthy People is that it recognizes, sorry, it's a little blurry, I guess, that health outcomes in people aren't just dependent on their individual healthcare behaviors, but rather in a whole host of physical environment, social environment, health services factors as well. So as part of Healthy People, the U.S. Department of Health and Human Services Maternal Child Health Bureau was charged with measuring healthcare quality for children with all chronic conditions and special healthcare needs. And they've done this on a regular basis using several national parent-reported surveys, which I'm going to be talking about today. One is the National Survey of Children's Health, which was done 3 times. And one was the National Survey of Children with Special Healthcare Needs, which just assessed healthcare among children with chronic conditions, which was also done 3 times. And moving forward, these are going to be a combined survey that happens annually. These surveys provide the best valid population-based, parent-reported data on children with special healthcare needs and their healthcare experiences. And they can be generalized both to the U.S. non-institutionalized population at large, and also to individual states. So that is the framework we're going to use, but I just want to say also that I think it still poses a lot of problems, and these problems are particularly challenging for autism. One is that measuring parent-reported healthcare quality for autism is really challenging because parents have to report the diagnosis, and at least on a research basis, this does not always perfectly coincide with what we would consider a medical diagnosis for autism. And to give you an example of that, in national surveys, there's a large portion of kids who have autism that resolves in childhood. And while we know that there are kids who ultimately don't reach autism diagnostic criteria as adults, this proportion is quite a bit larger in national surveys than it appears to be in real life. So it's not always clear that we're measuring what we think we're measuring. The thing I'd say is that measuring healthcare quality assumes that there is some sort of gold standard quality care, but in fact, we don't really have a good consensus on what the best care is for kids with autism, and that we have a sense that they should be getting care and that maybe more care in early childhood is better, but the exact details of that care and whether it should be parent-initiated versus therapist-initiated, or whether it should be ABA or other kinds of modalities, I think the evidence is still building on that, so that's really challenging. Another issue is that children on the autism spectrum have a wide variety of severity of functional impairment. And so a lot of times if you're looking at two different kids with autism, it's really comparing apples to oranges in terms of what their needs and unmet needs might be for care. And it's a condition that crosses the medical and educational systems. And so measuring quality in one area, so some kids may not be using many medical services at all, but might be using quite a few educational services and vice versa. Finally, there's a long time horizon for health outcomes, which I had mentioned before, which makes quality measurement challenging. And when you're comparing across years, especially given that the prevalence over the past 10 years has dramatically increased, the population that we were probably measuring in 2000 with autism is rather different than the population that we're measuring now. And then the final challenge is that autism is a condition that on the whole is associated with a pretty high level of functional impairment, especially compared to other conditions, say like asthma or even ADHD, for instance. And sometimes it's hard to tell if the problems that children with autism experience in their healthcare quality is truly due to autism as opposed to the fact that they're just kids with impaired functional status. And so this makes it especially challenging for people seeking to measure it. All right, so the rest of the talk, I'm going to talk about these 6 core quality measures from the Maternal Child Health Bureau. I just laid them out here so you can see what they are, and we'll go into each one in a little bit greater detail. The first is that families of children with special healthcare need partner in shared decision-making regarding their child's health. Second is that they receive coordinated, ongoing, comprehensive care within a medical home. The third is that they have adequate private and or public insurance to pay for needed services. The fourth is that they're screened early and continuously for special health care needs, which in this case really is just access to preventive medical and dental care. The fifth is that community-based services are organized so families can use them easily. And the last is that youth with special health care needs receive the services necessary to make transitions to adult health care. So first I'm going to talk about shared decision-making, which is the first core outcome. Shared decision-making is really interesting in autism, like I mentioned, because there's quite a wide variety of therapies available for parents to choose from, and often parents will sort of describe it being a situation of kind of starvation in a sea of plenty, where there's so many different things they could possibly do for their kid that it's very difficult to decide which one they actually want to do. In the national surveys, this is measured as child's doctors discussing a range of healthcare treatment options with families, encouraging parents to ask questions or raise concerns about care, and making it easy for parents to ask or raise questions, and then also respecting parents' treatment choices once they make them, which is another really interesting issue in autism, since sometimes parents will make treatment choices such as immunization refusal or use of complementary therapies that us as providers might not support fully. So we, with my colleague Ellen Lipstein at Cincinnati Children's Hospital, we actually looked at shared decision-making in autism and we compared it to several other health conditions to see how children with autism performed, and we used these same quality measures that are shown right here. And this just shows you, we compared autism to asthma and ADHD, and it's a little complicated because there's comorbidity between the conditions, so some kids have both conditions. But you can see if you compare children with autism who don't have ADHD to children who have ADHD and don't have autism, this composite shared decision-making measure, which is combined of all the shared decision-making items, is pretty low in autism, only about 57% compared to ADHD's about 69%. Then if you compare, so these are 2 different mental health conditions, and then if you compare ADHD, which is another mental health condition, to asthma, which is a physical health condition, you can see that both that compared to a physical health condition, both ADHD and autism perform the worst. And this is true for the overall measure and then for each of the subcomponents. So doctors discussing a range of healthcare treatment options, encouraging parents to raise concern, making it easy for parents to ask questions, and respecting parents' treatment choices. That autism performs worse than these other similar conditions. The second core outcome is that children with special healthcare needs receive coordinated, ongoing, comprehensive care within a medical home. The medical home, basically, according to the American Academy of Pediatrics, has these 3 components, each of which have subcomponents. So the first is that you have a personal provider and preventive care. That's defined as having a personal doctor and nurse and having a usual source where you go for health care. So do you have a place to go? The second is the care, family-centered, compassionate, and culturally appropriate. So once you get there, how is that care? That's defined as whether doctors respected parents' treatment choices and whether they received family-centered care, which has a number of components I'll go into. And then the third is whether healthcare is accessible. So again, care is considered to be accessible if there's no problems accessing needed referrals for the child and the child received all needed care coordination. This research by Bracklow in 2007 looked at medical homes specifically among children with autism, asthma. People like to compare asthma because it's a very different health condition. And then CSHCN means children with other special health care needs. And you can see this is the odds ratio is the likelihood that you will have the outcome. And so an odds ratio less than 1 means you were less likely to have the outcome. And an odds ratio more than 1 would mean you're more likely to have the outcome. And so compared to this reference group, which is children with other special health care needs, children with autism were less likely to overall have a medical home, and especially less likely than asthma. And then if you break it out into which of those 3 components shown previously was particularly lacking, what you can see is that it's actually this area that pretty much drives the whole outcome, is the care, family-centered, compassionate, culturally appropriate. That kids with autism actually are within the margin of error, getting preventive care, and the preventive care is marginally equivalent in accessibility, but the quality of care itself is pretty lacking. And if you look at family-centered care among autism, you can look at which parts of it are really poorly performing. And so these are the key components of family-centered care. Does the doctor spend enough time with the child? Does the doctor listen carefully? Is the doctor sensitive to your values and customs? Did you get needed specific information? And did they help you feel like a partner in care? And this really great study by Montes and Halterman basically broke out autism, kids with autism versus kids with other special health care needs, and then among kids with autism, kids who were Black versus white. And you can see that this is the percent who sometimes or never got this outcome, so a longer bar is bad. And basically you can see this is white kids with autism, this is Black kids with autism, and these are the Black and white kids with the other conditions. Almost across the board, kids with autism did the worst, and the minority kids with autism were less likely to get nearly every single component of family-centered care. The third core outcome is whether families of children with special health care needs have adequate private and or public insurance to pay for needed services. And insurance adequacy is defined as whether the child actually has insurance, because if you're uninsured, then it's not adequate. If you don't experience any gaps in your insurance coverage, and then if the benefits meet the child's needs, allow the child to see healthcare providers he or she needs, and that families pay a reasonable amount out of pocket. And the good news for autism is that most kids have insurance. And in fact, children with autism spectrum disorder compared to other conditions have a higher rate of insurance compared to children with other special health care needs, with about 98.3% insured. And although it's disturbing that about 1 in 10 experiences insurance gaps, this is actually comparable to other conditions for children. So while it's not great, it's not particularly worse than other chronic conditions in childhood. And this is probably because actually getting any kind of services for your child with autism is pretty expensive. It requires insurance. But the real disparity we see here in terms of kids without autism versus kids with autism is in terms of whether the insurance is adequate to meet the child's needs. And so if you compare, these are children with no special health care needs. These are children with other special health care needs, but not autism, and these are children with Autism Spectrum Disorder. And you can see only about 59% of children on the autism spectrum are having adequate insurance to meet their needs, which of course is because their needs are much more elevated compared to other children. So an insurance package that might be adequate for a typically developing child will fall short of the needs for a child on an autism spectrum. This core outcome 4 says children are screened early and continuously for special health care needs. This basically means, did the children access primary care in the medical or dental arenas? And overall, this is not too bad for autism. Well, it's not great because only 79% of them actually meet both of these indicators, but it's comparable to children with other functional limitations. It is significantly less than children with other special health care needs. And I was really interested to see, like, are people not the, whatever it is, 21% of kids who are not reaching this outcome, are they not getting it because of the medical component or the dental component? There's actually been very few studies of this, which is interesting. So for the preventive medical care component, it probably won't surprise you if you take care of children on the autism spectrum, but actually they come in a lot. And that if you look at the number of visits for preventive care, the mean for autism is 3.89 per year versus children without autism, it's significantly lower. They also use more care across the spectrum, so they have more emergency care, emergency room visits as well, and then also more non-emergency visits, which is consistent with having a impairing chronic condition. It's interesting, there is no research on access to preventive dental care for kids on the autism spectrum, which is interesting because, as was brought up in the previous talk, that can be a particular challenge for these kids, and we do know that these kids have higher unmet dental needs and also poor quality of their teeth. So if anyone wants to do a research project about this, let me know. The fifth outcome is our community-based services organized so families can use them easily, and community-based services here means all of the services that a child might use or need in the community, including early education, disabilities, developmental disabilities services, WIC, food stamps, things like that. And this question asks, were parents frustrated in getting these services for their child, or did they experience difficulties and delays receiving these services for their child? And actually, with my colleague Olivia Lindley, we looked at this and comparing across other developmental delay conditions in autism, and asked how many kids were able to easily access these services almost all or all of the time. And you can see overall it's not that great. It's only about 50% for all kids. This is kids with developmental delay. It's about 56%. Autism is significantly less than children with garden variety developmental delay, but similar to kids with intellectual disability, which in this survey is basically a severity marker. The last core outcome I just wanted to talk about was that youth with special health care needs receive the services necessary to make transitions to adult health care. And I know we have a whole panel on this, so I'm not going to belabor the point. But basically, it involves two key components. The first is anticipatory guidance for transitional to adult health care is provided to youth. This means talking about shifting to an adult provider, talking about child's changing needs as they age, and then talking about insurance coverage. And then the second is the doctors encouraging self-management skills. And the American Academy of Pediatrics recommends that for children with special health care needs, primary care providers start talking about transition to adult care around the age of 12, and that by 18 they should have a written transition plan, which as you'll see, it does not happen too often. So how many of the kids met this indicator in terms of receiving the necessary services for transition to adult health care? This is one of the worst of all the outcomes. It's only about 20% of children with autism and only about 41% of children with other special health care needs. And sorry, there's a lot going on here, but I broke this out by each of the kind of components of it, and you can see how many doctors usually are always encourage children to engage in age-appropriate self-care. It's only about 48% of kids with autism versus nearly twice as much for kids without autism, which is, I think, particularly concerning given the dismal statistics we have on independent living and employment for adults with autism. And then this is for anticipatory guidance for transition to adult health care. And you can see, once again, that children with autism are less likely to have had a discussion about shifting to an adult provider, about their child's changing needs, and about insurance coverage than children without autism. And this last little thing, which is hard for you to see, is to show you that even if you adjust for all the differences between children with autism and other kids, like they're more likely to be boys and they're more likely to be a little bit higher income, these disparities still persist. And so it really is something about autism spectrum disorder itself. And then further, if you break out all the kids with autism spectrum disorder by how severe their parent reported the condition to be, those kids with the more moderate to severe parent-reported severity are the least likely to receive any kind of transition services. So that's concerning as well. So the last thing I wanted to say is I mentioned earlier that part of the problem with measuring healthcare quality is that part of it is disentangling autism from impaired functioning overall. And so I tried to do this a couple years ago with some colleagues at OHSU, and so we took all of these 6 core indicators that I previously discussed with you, and we compared children with autism, children with other functional limitations, and other children with special health care needs, and just looked at them all across the board. And then we also made a composite of like who got sort of the marquee kind of all of this care, usually or almost always of the time. You can see that just for each one, even if you compare to other children who probably are similarly impaired or perhaps more impaired, because not all children with autism have functional limitations, autism performs the worst. This one is probably the best. Transition services is the worst of the worst. And the number of kids who met all of the age-relevant quality indicators for children with autism is really low, that 21% didn't meet all of them compared to only 11% of children with other functional limitations and 7.4% of children with special health care needs overall. So I just wanted to move on to 2 other key points that I thought were kind of key to understanding this whole thing, and say that another thing that we don't measure often in autism healthcare quality is timeliness of diagnosis, which is something, as you know from my previous talk, I feel pretty strongly about. And as I mentioned earlier, autism diagnosis can be made by age 2 in most kids, but this national data from the Survey of Pathways to Diagnosis, which is one of these national parent-reported surveys, shows you that timeliness is a major problem, and that 40% of children with autism are diagnosed at age 6 years or over, which basically means after they enter the school system, and children who are diagnosed at age 2 or younger, at least under age 3, are still a pretty clear minority. And one of the things that we have to ask ourselves as providers is what is contributing to these delays? Is it our parents, and some people brought this up earlier, are parents not coming to us and asking us about it? Or are they coming and we're not listening? And we actually looked at this a couple years ago and said, okay, when are parents first concerned? When did they first discuss autism with a healthcare provider? And when were they actually diagnosed? And this here in the yellow box just shows you the age. This is the mean age that a parent first had concerns about their child. And this is in population-based data in the US, was 2.1 years. And the age that the parent first discussed the concerns with a healthcare provider was 2.3 years, which basically means there was 0.2 years, which is like 1.5 months between when parents were concerned and when they first interfaced with the healthcare system. It's not a long time. They're coming and talking to us. But what happens is that the mean age when the child is told they have autism diagnosis is 5.2 years, which means there's an average 2.7-year delay between when a child comes and talks to a healthcare provider, or when a parent comes to talk to a healthcare provider about their concern, and when a child's actually diagnosed. Like, the vast majority of delays in autism diagnosis are occurring after contact with the U.S. health system. And I think that this is an important quality measure that we really need to focus on moving the needle on. And then the last comment I just wanted to make is I think that when we think about, even though I just spent all this time discussing autism versus other health conditions, in some ways it's kind of an artificial distinction to be made. And this is mentioned in the previous talk as well, in that the majority of children who have autism do not just have autism. This shows you children who are typically developing without autism, or just in general, have 90.9% of them have 0 to 1 chronic condition, and only 6.5% of them have more than one condition. Among children with autism, 50.6% have 4 or more chronic conditions. And so I think, although it is key to compare kids with autism to kids with other conditions, it's not, in fact, the situation is much more complex in that if we don't attend to all these other conditions that children on the autism spectrum also experience, we're really doing them a disservice. And this just shows you, I think it was shown in the previous slide, what those other conditions are. So I think, as you can see, healthcare quality for autism is rather poor. It's particularly challenging because of some of the reasons I talked about before. This is a condition where prevalence is going up dramatically. The healthcare system hasn't caught up to the care needs for all of these children. We have a severe lack of training in our primary care workforce, where primary care does not feel comfortable with autism. There's a lack of specialists who are capable of taking care of these people, and as some of the previous commenters have noted, sometimes families will have to travel quite a great distance to get the kind of specialty care their child needs, or families might have a very long wait to get these kinds of services. Sometimes the roles that we as medical providers versus the school system are supposed to play is unclear, and so often a kid can be passed back and forth between the different systems without anybody really addressing the root problems. And services are expensive. I mean, when you talk about giving a child 25 hours or 40 hours a week in early childhood, that's a significant funding burden. It's limited, and that's partly why wait lists are so long. We talked about the medical comorbidity, and then I think there's also still a great amount of stigma, both in terms of parents and healthcare providers, in engaging with this problem and wanting to address it in a timely fashion. So I'll definitely be interested in hearing from you guys on this panel. What else do you think are important healthcare system challenges to autism healthcare quality, and what you think we can do to try to improve this quality for all kinds of kids? Thanks.